Hello everybody. I hope you are having a good day. Today I am Dr. Ayesha Shahid, resident of Gynecology and Obstetric Department, Shaikh Zayed Hospital, Lahore. Today I am going to present one of my study which has been published last year titled COVID-19 Vaccination Acceptability Among Hospital Staff. These are the co-authors and corresponding author from the Department of Shaikh Zayed Hospital, Lahore, as well as University of Punjab. Globally, up till now, 546 million confirmed cases of COVID-19, including 6 million deaths, has been reported to WHO. Like many other countries, Pakistan has also experienced the burden economically in terms of morbidity as well as mortality, and approximately 1 million confirmed cases of COVID-19 with 30,000 deaths has been reported till now in Pakistan. Healthcare providers, including doctors, nurses, paramedics, staff, community health workers, remain at high risk due to exposure and contact with the patients and had become an unexpected target in the fight against COVID-19. Concerns about rushed cases of COVID in the country, hence the vaccination is considered to be a significant measure to combat the coronavirus pandemic. But as soon as the vaccine is available, complexity exists for its acceptance as well as willingness among individuals. Thus, this study aims to assess a willingness to get COVID-19 vaccine among healthcare providers and other hospital staff, including nurses, paramedics, janitors, as they are more exposed and vulnerable to contracting this deadly virus. It is basically a mixed methods research, including both qualitative as well as quantitative data. Doctors, nurses, paramedic staff, janitors currently working in Shaikh Zayed Hospital, Lahore, Pakistan were selected. Whereas staff diagnosed with COVID-19 currently or previously with PCR and antibiotic testing were excluded from the study. In this study, convenient sampling was done, in-depth interviews were taken. As a result, themes were emerged through probing and data was collected till the saturation point reached. This study includes many interesting results. This study identifies that 52% of the healthcare providers were in favor to get COVID-19 vaccine, whereas 48% of them has refused vaccination. The reasons were included in the in-depth interviews and the themes which will be shared later. Significant predators for the COVID-19 vaccine acceptance were age, gender, education, marital status, occupation, and monthly household income of the respondents. Whereas the predators affecting the willingness were exposure to the patients. 58% of the persons think that exposure to the patients, and 33% of the persons think that the vaccines can cause protection against this deadly virus, which will help in protecting not only themselves but also their family and community. The reason for refusal of the vaccines include different themes, which are as follows. 36% of the respondents from the study stated that there may be the difficulty in availability of the vaccine once launched in the country. 45% thinks that there may be the affordability issue and one may not afford the vaccine. 8% of the respondents think that the vaccine may have any does not have any good efficacy, while the 8% of the respondents from the study think that The social media has influenced them so much that they deny to get themselves vaccinated. 8% think that the vaccine is in currently the trial phase and hence it must not be administered once uh, proven its efficacy and safety. Few people think that the less research is available for its safety and efficacy profile, and hence it must not be administered. 91% of the respondents who refused in this data state stated that they have distrust in the vaccines, they have trust issues for the vaccine safety and efficacy. 58% think that they have the safety issues with the vaccine. 33% think that vaccine may have side effects, including that one may contract COVID vaccine after vaccination. This is the socio-demographic characteristics and its association with the COVID-19 vaccine willingness. In this table, it has been shown that 67% of the persons who are willing to get COVID-19 vaccinations came under the age group of 20 to 30. 67% of the male and 33% of the female thinks that the vaccine is safe and can be injected. 92% of the respondents who have higher secondary education and above think that vaccine must be administered. 58% married people think that the vaccine, they are willing to get themselves vaccinated. 83% of the persons in the data from the medical department, including doctors and nurses and paramedics, think that they can have themselves vaccination administration, while 17%, including the janitors and other paramedic staff, thinks that the vaccine is not safe and it's a myth and there are misconceptions regarding them and they refuse the vaccination. The people who has a monthly household income more than 50,000 are willing to get themselves vaccinated, and hence the p-value got significant, that is less than 0.044. This bar chart includes the respondents' coronavirus statistics, in which we have interviewed the respondents, and the result came as 24% of their family members were diagnosed with COVID, and hence this led them to think of vaccination. 79% think that they are at the urge of getting COVID-19 during their daily practice and routine in hospital work. 49% were exposed to the COVID-19 positive patients in the last 14 days. This statistically basically led the people to think that the vaccination may provide protection not only to themselves, but to the community and their family members as well. Thus, the vaccine acceptance play a pivotal role in the combating the coronavirus pandemic. But as soon as the vaccine was available, its acceptance became a challenge among the community, and vaccine hesitancy became a major confounder on its acceptance because of spread of misconception and myths towards vaccine convenience, affordability, availability, effectiveness, safety, and side effects, which were already discussed with percentages. Therefore, the vaccine is need for an hour and we must develop awareness through health education programs and campaigns to get ourselves vaccinated, not only to protect us, but again to protect our family members, our close ones, and the community as well. In Pakistan, the statistics of the vaccinations include that a total of 287,170,265 vaccine doses have been administered. So, hashtag vaccine saves life. These are the represents included in the study. Thank you so much for your valuable time. I hope to have a good day.